doctors that are getting exposed to this science are really seeing modalities that they can use, and they're welcoming it. They're very enthused. They're very excited about it. But you know, the excitement that I get, I'm out in the field, and I talk with people every week in different parts of the United States, and I get shocked and stunned and amazed at the stories coming from this powder. Not that we are doing scientific studies on each of these individual cases. It's just simply the mass of statements and comments and testimonials that are coming. And we basically have found that almost every single person is having some type of benefit by raising glutathione. Does this make sense after what you heard tonight? So what your benefit is going to be yours in particular. We don't even make a claim about what kind of benefit it's going to be because we don't know what your specific benefit will be. That's why we don't even make any claims. So individuals that use the product, they develop a story. You want to hear my story? Go like this. Well, 5.5 years ago, when I took a trip up to Canada, I had read several hundred pages of clinical studies, and at the time there was only one product here at the company. It was the Immunical product. And initially, when we first released it, we didn't have the science worked out how to fill the sacks pharmaceutically, the little packages. We had it in little canisters. And when you open it, you had a little scoop, and a little atomic bomb mushroom cloud would come out of the can, and it would go all over your hair and your eyes and your glasses. But eventually we were able to get machinery that could very slowly put it down into these pouches. And of course the pouches are now able to withstand temperatures up to 140 degrees. And they're waterproof, they're airproof, and it keeps the product good for several years. So this is really an advanced type of protein packaging. No one else has it, really. You won't find it anywhere else. But anyway, I read all this documentation about glutathione, and I felt I better go and check it out myself, which is what Dr. Gutman just basically said. Check it out yourself. I called the company in Montreal, and I said, listen, I'd like to come up and see your facilities. I'd like to meet these doctors, see if Dr. Bunos is a real person. And sure enough, I flew up there. They said, look, if you want to come up, we'll pay your hotel. We welcome you to visit. In fact, to this very day, anyone that wants to go up there and visit, they will pay your hotel room and feed you and tour you. It's called the red carpet treatment. So I got to meet this man, and the most difficult part about this picture I found was getting his hair to stay down. Because he doesn't bother combing his hair. He doesn't think about how he looks. He's a real scientist. And I spent many hours with him, asking him many, many questions, and he had the answers. He had the answers. And I got to meet some of the principals of the company. And that was an experience because the three men who own Immunical, it's still publicly held, are John Molson, Chuck Roberts, and Dieter Beer. Now, of course, the Molson family owns Molson Beer. You've heard of that probably. And that family is not short on money. The Roberts family introduced Kraft Foods into Canada, and they're well heeled. And Chuck Roberts himself made many millions of dollars in his younger years with the ski wear industry. As a matter of fact, he at one point owned 90% of all the ski wear industry in the world. He had 90% of the market. He owned Jean-Claude Keely and Descente and Pedigree, all of the very expensive ski wear that you see the Olympic stars skiing down the mountains with. And of course, Dieter Beer, probably the wealthiest of the three, he's made his wealth in the electronics industry in Europe. He owned the largest chain of electronic stores in all of Europe. So these men actually got attached to the product not because they needed money. In fact, two of them were already retired. And they came out of retirement because they got attached to the potential of what the powder could do. Dieter Beer, for instance, gave it to his mother, who was in her late 70s. And his mother had developed a growth on her lungs, which was inoperable. So they would not do any operation. And he was a little bit nervous about chemotherapy and radiation because she had a weak heart. So Bunos, when he met Bunos and Bunos told him about this, he asked, well, could it be of help to her? And he says, well, all the clinical trials we've done, both with humans and animals, have shown anti-tumor properties. As a matter of fact, we've received a patent for anti-tumor treatment, a method of use patent that is both a prophylaxis and a method of use treatment for cancer. So that speaks volumes about the possibilities of prevention. Anyway, long story short, Dieter's mother is still alive. She's been on the product now for 15 years. And she's the longest human in the world on this product. Dieter's the second longest human. And she's in her 90s and she has no growth on her lungs. So there was a kind of an emotional attachment to it. And that's why he was able to go for it. He actually put up $10 million out of his pocket, personally, to finish the research and get those patents. So it's not something that was developed in a garage. This was something done with a top-notch scientist. Dr. Kong Shavin was the chief professor of immunology at McGill University. And of course, Dr. Bunos has been awarded so many awards I've lost count, but his most notable recent award is they've named him one of the top 30 scientists in the history of Canada. So these are men and women that have really made a tremendous contribution. Now, once this product was released to the public, then the stories started coming in. They started rolling in. And I brought back some powder myself. I brought back a case of this stuff down to Florida. I was living in the Fort Lauderdale, Miami area, and I came down from New York to help take care of an aged in-law. My mother-in-law had gotten very ill, and subsequently I bought a large house. We moved her in with me. And there I pretty much sat with my mother-in-law for the first year or so. She had developed fibromyalgia. She had serious arthritis. In fact, we had to take her to get cortisone shots straight into the knuckles, straight into the neck, the back, the knees, every few weeks so she could move. Now, of course, the cortisone is going to get you eventually because it will accumulate, but yeah, it was the lesser of two evils, I guess. Her pain was so great that she would pass out. And so she was put on full disability, governmental disability. You think it's easy these days to get on disability? It is difficult. They pretty much figure you're worthless and send them a check every month. That's how you get on disability. So she was on disability. She was in early stage osteoporosis. Her bone density was dramatically reduced. So I came back from Canada, and with a little bit of urging on my part, I got her to try it. And I was astounded. Bunos told me, you better put her on 2 a day because she's got a lot of health challenges. 1 a day if you're healthy, 2 a day if you're sick. Okay, that's what if you're kind of dying, we go 3 or 4. So it's not difficult to remember the dosage. So put her on 2, and within a few days, I began to see her walking around the house. Now, she was a couch potato. I mean, she just did not get off the couch. And another few days go by, a week goes by, I see her sweeping around the house a little bit. Then she starts going out shopping a little bit. In 3 months' time, just adding this powder to her diet, she was a different woman. You could not recognize her to be the same woman that I saw there on the couch 3 months earlier. It was that astonishing. As a matter of fact, she went out and bought her own house and moved out. She's into real estate investing now. She owns 3 houses. This woman has her life back. All she did was add this powder to her diet. Now, you can imagine how much I talked about this product after I saw the phenomenal results with my own mother-in-law. And this, frankly, is a type of story you can multiply by the thousands now that people are starting to use this product. How many of you tonight already thought to yourself, man, I know somebody that could use this? How many of you? How many of you already, see what I mean? You can't help it. You understand? You think of somebody that could use this science. You see? And you've just heard about it maybe by accident. Maybe somebody that you know bugged you to come here tonight? How many of you got bugged to come here tonight? No? Yeah, the rest of you are lying. That's how it happens. You know, you just happen to flukishly hear about it. Well, if you've thought of people that you think can use this product, the next step is for you to know how to get it for yourself. All right? Now, the company had entertained a lot of different ways of marketing this. Obviously, with $10 million worth of data, 7 pharmaceutical patents, you could go to anybody. And they did. They went to the biggest drug company in North America, has worldwide offices. That company offered them, after several months of research, they offered them a huge contract. They wanted to have exclusive rights. They wanted worldwide rights. And they didn't want anyone else to have it. Well, fortunately, the night before the contracts were signed, the chief medical director for that drug company called Mr. Beer. He said, "Mr. Beer, don't sign the contract." He says, "What are you talking about?" He said, "Well," he says, "first of all, I want to extend my appreciation to you for letting me have this powder for my father. My father's been very sick with cancer. The chemotherapy was making him very ill. I used the powder the last couple of months. The side effects have disappeared from the chemotherapy, and he's gone into remission." So the man had a little bit of a conscience problem. He said, "Now, I'd get in trouble if they knew I was telling you this," but he says, "There's 3 things that you should know. First of all, they don't feel the product is mysterious enough for them to market as a drug." He says, "What do you mean?" He says, "Well, they're afraid someone will find out it comes from milk. Nobody finds out where our stuff comes from." Number 2, it's expensive. Even at $1 or $2 a dose, it's far out of line with what we do. We do maybe things for pennies that we sell for dollars. And it's true. It's true. For instance, the heart medication, highly active antiretroviral therapy, HAART, cost about $30 to make, and they sell it for up to $3,000 a month supply. Now, that's why the African countries can't afford it. It's just too expensive. But that's the markup. I'm in the industry, so I've found amazingly how much the things cost. It costs for a prescription antacid about 85 cents to make a bottle of 30 tablets, including the label. They sell it for $120. This is the markup. So by that same standard, Immunical would be very expensive. In fact, there is one country right now where it is a drug, and that's Germany. In Germany, you have to have a doctor's prescription. You have to go to the pharmacy to get it. Insurance pays for it. But if you want it for yourself as a wellness product, it's $600 a box. Now, how many people are going to be able to afford that? Here in North America, it's marketed for $60 a box. And so we call it a $2 a day habit. That's a lot more affordable. So are you glad we didn't send it through as a pharmaceutical? Yes. Go like this. Yes. So the truth is that we've got something that's safe, effective, affordable, and for the first time available in a large scale. So if you're thinking about that friend of yours or about yourself, first thing you do is you get together with the person that invited you here tonight.